I think it's more complicated than people would like to indicate. At the end of the day, over the last 10 years, the budget for the health service has gone from 90-something billion from memory to 150-something billion. You know, the funding is there above inflation, but the demand is like that. And actually tackling that in terms of the scale of that demand and the complexity as well. As we live longer, we have more complicated conditions. You know, the NHS was never built for that, and that wasn't the case, 15, 20 years ago. So it's difficult to tackle.
Is the argument about the size of government, the size of the state, right? I've been talking ever since the leadership contest last year. Kemi Badenoch said something really interesting, which is, what is government for? What's the councils for? Clearly, and I've had the NHS conversation, haven't we, in recent weeks. Money goes up and up and up, but demand goes up and up and up by more, and therefore you'll never catch up, and it's not sustainable. And that's not an easy conversation to get into, and you can see why politicians don't want to get into it. I'm about to go in and raise some questions about recent announcements on NHS backlogs in care. Obviously, run or responsible for social care in Nottinghamshire.
It's really pleasing actually to hear from across the House today a focus on capacity in domiciliary care, which actually is huge priority, and ultimately it's where we want people to end up, independent in their own homes as far as possible.
You know, we're making big strides towards that. We've got some big programmes of work where we're trying to change the way we deliver services, to be more active in communities, to support and enhance those things within communities that make the biggest difference to people's lives, that early help and support that keeps people independent.
And we all know we need happy, healthy staff in our NHS, in our wider health services. They have untold pressures on them as it stands, from COVID, from the cost of living challenges, from short staffing in departments. Absolutely, we all understand that. But I think my message to the Shadow Minister opposite might be that saying that we want things to be better is not a plan. The truth is that it's more fundamental than just being an issue of staffing. I think probably the Shadow Minister deliberately misses that point. Two things I wanted to raise. First is care. Let's not forget care. I don't understand how you can raise this without talking about care. The government's proposal around integration is absolutely integral to all of this. Second is reform. No amount of money in chucking reform into this system will fix it. Demand has gone through the roof. The public expectation of our health service has gone through the roof. And the capacity has increased, but it's never enough because we add more and more to it. And we expect at all times our health service to provide everything we want for free in an increasing range of services. It's not possible, it's not feasible. And we have increasingly complex and expensive needs, an older population with more working age disabled people, more lifelong and chronic illness, more mental health that the NHS was never set up to deal with. Most of us agree, I certainly agree, that basic healthcare free at the point of use on our NHS and through our NHS is absolutely right and fundamental to Britain and what a lot of us see and feel about Britain and what we believe in. But it can't grow forever at the expense of other services, at the expense of education, at the expense of infrastructure. At some point, we're going to have a conversation. It'll be a brave government that does it, but at some point it will have to happen where we draw a line around a basic set of services and expectations that people can access for free, and we have a proper conversation about how we do the rest, because it is not sustainable to just keep chucking more money in a pot and expecting hard-pressed NHS staff to offer and deliver more and more and more and more when we know that are never going to catch up with an increasing level of public demand and expectation